You see many of the women out there, they begin to notice that there are certain discharges that they see in their breast all the time. It's not the time for you to lactate, or it's not the time for you to breastfeed your baby, but you begin to see that you have discharge, you have breast milk coming out of your nipple in your breast. This might be as a result of a certain condition. So here in this video, I'm going to explain to you why you see those discharge, and when you see those discharge coming out from your breast, is it normal? And what do you do if you experience those breast discharge? You are welcome to my channel, Ask Nurse Malik. Today in this video, I'm going to explain 5 causes or 5 major reasons why you begin to see that you have discharges coming out from your breast or coming out from your nipple. So what are those possible causes of you to have a breast discharge? Number 1 is hormonal changes. When you have any hormonal imbalances or hormonal changes which causes fluctuation in your estrogen and progesterone levels in your body, it can cause this breast discharge. You begin to see milk in your breast. Firstly, you need to understand that before you begin to see any discharge in your breast, it is as a result of hormonal changes. The presence of hormone called prolactin is the one that helps to initiate this breast discharge or making you to have a breast milk. Without this prolactin, there is no secretion of breast milk from your breast. So we need to understand this. Then I will now highlight the different causes or the different reasons why we begin to see this discharge if it is not as a result of hormonal changes or as a result of hormone called prolactin. So there are certain reasons that can cause you or that can make you to have any discharge. It can either be white or brown. So when you begin to see this discharge, there are certain causes or certain reasons that can make you have that discharge. What are those causes? Number 1 is when you have breast infection. There are certain infections that can happen to your breast, especially when you have mastitis. That is when you have an inflammation that causes abscess or that causes pain or tenderness in your breast. This can result you to have a discharge from your breast. And in this kind of case, this kind of discharge, it is not going to be a normal milky discharge. It is going to come out with pus. So you begin to have discharge from your breast. The second reason is when you have thyroid disorders. There are certain thyroid diseases that you can have, such as hypothyroidism or hyperthyroidism. That is when you have excessive secretion of the thyroid glands. This can, as a result, cause you to have discharges or you begin to see discharge from your breast. Then thirdly is when you have breast cancer. Having discharge or seeing discharge coming out from your breast is a presumptive sign of a breast cancer. Sometimes it cannot be painful or it will just be tender. Then you see discharge coming out from your breast. That is a sign of a breast cancer. So you need to get your doctor to assess you for breast cancer and check if those discharge coming out from your breast is a discharge as a result of cancerous cells in your breast. Then fourthly is a condition we refer to as galactorrhea or you have prolactinoma. This is a condition where you have the enlargement or you have tumor in your pituitary gland. So when you have this tumor, it can cause excess secretion from your pituitary gland to secrete prolactin, which is a hormone that helps in producing your breast milk. So once there is excess of this hormone from your pituitary gland, it can increase your risk of having excessive discharges from your breast. This might be another reason why you have or why you begin to notice those discharges or those milk from your breast all the time, even when you are not pregnant or when you are not breastfeeding. Last but not the least reason why you see discharges from your breast or why you produce milk from your breast is when you are pregnant or when you are breastfeeding. During this stage, there is release of prolactin. That's a hormone that helps in production of your milk in your breast. So it is normal in this situation if it is during pregnancy or during breastfeeding. If it is not as a result of these 2 periods, that could be a sign of a problem. So it will be best for you to seek medical advices so that you'll be able to know the reason behind the discharge, if it is a sign of infection or a sign of hormonal imbalance in your body. What then do you do if you notice those discharge in your breast? Very importantly, without going to doctor or going to your nurse, the first thing you should do is that 1, you should observe the discharge. Observe the color of the discharge, the consistency, how often is it coming out from your breast, and how is the frequency. Is it every time or every day? You need to observe that. The number 2 thing you should do is for you to check for other symptoms aside this discharge. Look out for any signs of infection. Do you have any redness around the area of the discharge, or you have a swelling, pain, or any tender breast? This could be a sign of a cancerous breast, so you need to also note that or observe that. Then 3, consult your healthcare provider. Your healthcare provider will help you to assess your breast and check if there is any abnormalities or if it is a sign of a danger like breast cancer, so that you'll be able to take the necessary action or the necessary steps that it ought to be taken. Your healthcare provider might suggest you for an image test like the mammogram or the ultrasound scan, so that you'll be able to evaluate all the tissues in the breast, or they can ask you for some blood tests. This will enable you to rule out any possibility of hormonal imbalances or any other medical conditions. So it is always better to stay on a safer side. Take caution when it comes to your breast health. Always make sure you talk to your healthcare provider when you see any changes or when you notice any discharge, discoloration that you see in your breast. Note them down and have them said to your healthcare provider. They will look for a better and a longing solution to it. Thank you for joining us today in this video. Don't forget to subscribe to this channel, like this video.